My name is Miranda Olding. I'm the clinical nurse specialist at the MS Therapy Centre, Beds and Northants. A relapse is defined by new symptoms or the occurrence of symptoms that you've had before but not for the past 30 days that last for at least 24 hours and are not being caused by an underlying infection or by heat or just by becoming incredibly tired. So they have to last at least 24 hours. In fact, they often last a lot longer and are not being caused by infection. Cells from the immune system, so the brain has a good blood supply, obviously everywhere in our body has a blood supply, but there are immune cells circulating within our blood which are not supposed to cross the blood-brain barrier, which is a really thin layer of cells which should be very tightly together in what we call tight junctions. So those cells are not supposed to cross into the central nervous system, the brain and the spinal cord, but we don't know why, but immune cells cross from the blood into the central nervous system, and once they're there, they recognise myelin as a pathogen or an invader, something which is alien, because those cells are actually in an alien environment. They shouldn't be there. So they've become confused. They recognise myelin as alien. Myelin is the fatty covering which acts like a sort of insulating wire along the nerve cell, and they seek to destroy it. The result is that when the myelin has been damaged, the action potential or the electrical signal can't get down the nerve in the way that it should. It's either slowed down or completely stopped from passing, and then you get symptoms in various parts of the body because the nerves can't transmit their information. A true relapse, a true inflammatory demyelinating episode in the central nervous system should be able to be picked up on MRI, but we know that up to 40% of those can be missed. So they can be missed because the scanners aren't powerful enough. So scanners actually vary in their power and their effectiveness. And also, you can have clinical symptoms from an incredibly tiny little lesion, and those tiny lesions aren't necessarily picked up on scanners. The other problem is that you don't necessarily get your scan immediately that you're having that episode, and actually lesions form, they both form and they heal up. So your body remyelinates in the relapsing remitting stages of MS, and that's putting more myelin down and repairing the damage. And in actual fact, the bright spots only show up when the nerves are in a damaged state, and so if you end up having an MRI 3 months after the event, it may well not show up. It can be a grey area even for your healthcare team. So a relapse, as I say, it would either be new symptoms or it would be old symptoms coming back. We would be expecting that to have some kind of impact on your everyday functioning. So it's very common in MS to have a lot of ups and downs, good days and bad days. And that's because there's a lot of fatigue in MS, and when you're fatigued, it's very difficult to cope, and everybody, feels good sometimes and bad at other times. But also, when your body remyelinates after a really true clinical demyelinating event, it's not quite as strong as the last covering of myelin. So what can happen is that myelin that's there, which has been put on afterwards, is more likely to short circuit under stress. So if your core body temperature is raised for any reason, so it might be because you've just had a really big workout, or it might be because you've just got a really low-grade infection, then the it becomes more easy to develop symptoms that might be a bit of an Achilles heel for you. So it might be that you get a numb right foot when you're really tired, or if you have a hot bath, or when you've had a workout, or if you run for more than half an hour or something like that. And that's just because that area is an area which struggles when you struggle. And that's not a relapse. If you can have a good night's sleep and then you wake up in the morning and you're okay again, that's not a relapse. Similarly, a lot of people with MS have some symptoms which they have to deal with on an everyday basis, which are always a problem. And so if something's pretty much always a problem, although you might have some days where you feel surprisingly good, that's not a relapse either. It's a kind of sudden event, or it might be an event that starts and then escalates and gets worse, maybe over a couple of weeks, and then kind of plateaus off and then starts gradually to get better. The number one thing is infection. So all of us MS nurses, when someone comes into clinic and says, I think I'm having a relapse, we always say, hold that thought. Do you have any cough? Do you have any cold? Do you have any viruses? Take this pot, let's dipstick your urine, and we need to identify whether there's any hidden infection. If there's hidden infection, yes, the MS will certainly be exacerbated. It can be, like a full-blown relapse, but what we need to do is treat the infection, and then everything should go back to normal. Sometimes an infection can act as a trigger for a full-blown relapse, but we have to have completely eliminated any infection before we even consider using steroids or anything like that. The most common option for treating relapses that need to be treated is using high-dose oral steroids. Having said that, the guidance from the Association of British Neurologists is that steroids should be reserved for the most disabling or the most distressing relapses. Now, how distressing a relapse is really subjective to the person. It depends how frightened they are, how dreadful they're finding everything. Steroids can speed up the recovery from a relapse because they are potent sort of anti-inflammatory in the short term, but they don't have any bearing on the overall outcome. So a relapse will either get completely better or get somewhat better, leaving some residual problems, or not, in its own time. Steroids, some people find steroids absolutely fantastic. They feel brilliant when they're on them. They get the whole house clean, they feel wonderful. Sometimes people really crash afterwards and feel terrible afterwards. Some people feel that the steroids really helped them through and speeded things up more quickly. Some people have a horrible time on steroids and they find they can't sleep at all. It's important that people understand the risks and benefits of steroids. Many people just choose to take some rest and wait it out and try and get better without steroids. And sometimes people choose, yes, do you know what, I want steroids now, and feel that it's really helpful. There isn't any evidence that's been published about exercise in relapses in MS. We do know that on the whole in MS, exercise is beneficial at reducing fatigue and pretty much all round. It's an absolute 100% yes in general. My personal advice to my patients is when you're actually having a relapse to just absolutely chill out, take care of yourself and rest. And if you're going to have any exercise, just make it very gentle, just a little walk in the fresh air, maybe when you're recovering a bit more, a very gentle swim or a gentle exercise class, but not to push it, not to do anything which actually raises your core body temperature and increases fatigue, because then you're just likely to just struggle with those symptoms of the relapse again. I think it's about making sure that you've understood how to identify a relapse. You've understood that whenever you're worried about potentially, are you having a relapse, to immediately get in touch with your your MS healthcare team. If it's more difficult to access your MS team, to get yourself to the GP surgery and just ask the practice nurse to dipstick your urine, so you know all those things to do. If you have people around you who are supportive, to talk with them about, because I have MS, it is possible that I may have a relapse at some time, and it'll probably be, necessary for me to take a couple of weeks off work, and I may need, it's really when life gets more complicated. So when, for instance, you've got young children, that tends to be a time when you really need to call on friends and family, because they're relentless and their demands just don't stop. If you're just living without, perhaps young children, you take the time off work, you can just look after yourself quietly at home and make sure your MS team are aware. But yeah, have those discussions. Think about who could you call on, what would you do? Maybe include those people in those chats. And if you realise that actually you would be in a pickle, then talk to your MS nurse about, what could I do then? Who could I call on at those times? What could we do? So that you've got a plan. Do everything in your power to address the MS. So make sure you are on the most appropriate disease-modifying treatment. And if you are on a disease-modifying treatment but still having relapses, that discussion is had with your neurologist and your MS nurse. Actually, is it time to switch up? Do I need a more effective treatment? Also addressing everything in your lifestyle to reduce inflammation. All the good things about healthy lifestyle. And then not to worry. Because there was a diagram that it says, is there something to worry about? Yes. Is there something I can do about it? Yes, no. If it says yes, yes. Have I done the thing? Yes. Then don't worry.